All right, let's talk bony anatomy of the hand, wrist, and elbow. So there's a lot going on here. So we're going to start with the hand. The hand is very similar to the foot, where there's phalanges, and then where there were foot bones, those were called tarsals, and then there were metatarsals were the foot bones, and then the tarsals were the ankle bones. Same thing with the hands, except it's carpals instead of tarsals. So we have our phalanges, distal, middle, proximal. Remember, proximal is like proximity, closest. Distal is like distance, further away. And then we get to our carpals, our metacarpals, which are our hand bones. So these right here, they align with each of the fingers. And a note on that, so most people, we will learn that they're numbered 1 through 5, starting with the thumb, 1, 2, 3, 4, 5. I worked in a hand clinic, so I learned that through athletic training. And then I worked at a hand clinic, and they actually have names because you deal with a lot of patients with amputees. So this is thumb, index, middle, ring, small finger. So moving to the carpal bones, there are 8 irregular shaped carpal bones. We're not going to memorize all of them for this class because you should have learned that in anatomy, and if you haven't already, then you will need to learn that. But we're in this class just focusing on human injury, so we're going to talk about the bones that result in injury because I may reference them more in this presentation or in the modules. So this long bone here is the scaphoid. If you look at your hand, so you're going to take your hand and go like this and stretch out your thumb. And you're going to find this little triangle here. This is called the anatomic snuff box, where people used to put their tobacco a long time ago and measure out their tobacco. So in this area right here, you see it? That's where the scaphoid is. So if you're ever palpating it, this is the bone most likely to be fractured anytime we fall and catch ourselves on a hand, or if you're a rafting guide or something like that, you're likely to fracture this bone. And it's a very important bone to recognize because if it doesn't heal, the blood supply is not good and it will die. And that is not good for your wrist. So that's an important bone, scaphoid. And then lunate, that one can actually move out of place very easily with a big high energy fall. And then this one, as you can see, there's like a hook right there. It's called hamate. We call this the hook of the hamate. And like a baseball batter getting hit with a pitch right here can break that off. So those are our 3 bones that we really worry about, but all of them sit in a certain spot. They're all connected by ligaments, and it's important that they all stay in their spot. So if one of those bones gets really unhealthy, like the scaphoid dies, it causes a problem because they all kind of move around and you get arthritis. So you also see how the radius and the ulna meet the thumb, meet the hand. Please recognize that the radius is the really wide one at the wrist. The ulna is going to be the smaller one. The ulna is going to line up with the pinky finger, the small finger, and the radius is going to line up with the thumb. So that's how we orient ourselves. The radius is the easiest one to break in a child. So that's usually what we deal with growth plate fractures. It's almost always distal radius from a falling on outstretched hand, foosh. Falling on outstretched hand injury where you fall and catch yourself with your hand. All right, moving up. The complicated thing here with this arm is that when you are in the anatomical position, so that the thumb is on the outside, so we're standing with our thumb on the outside, palm facing forward, that's anatomical position. They're going to be lined up just normal, but when we're using our hand and we turn over and we go palm down, and that's called pronating, then you'll see that they twist and they move. So all of that twisting comes from the radial head. So when we move to the elbow, it's important to recognize that we have this pivot joint on this side with the radial head where it's literally turning, and this needs to be a perfect cylinder. So one of the injuries we're going to talk about in key injury spotlight is osteochondritis of this. As it breaks down, if there's any kind of bone or fragment in this joint, it won't be able to twist and you won't be able to pronate and supinate. All of that motion, pronation and supination, is coming from this radial head joint. Also, if you go to the outside of your arm and you just rotate, palm up, palm down, you feel something rotating, that's your radial head, and that's how we find a radial head. And then we move to the other side to the olecranon. This point, that's our olecranon. That's the end of the ulna at the elbow. And so if you're looking here, you see the end. The other side of this is called the coronoid process. And you see this? What does this look like? This looks like the knee. This is a hinge joint, and it functions just like that. So we have this hook on this side, the olecranon. The front, the anterior hook is the coronoid process. And this is just like the knee where it's a trochlear groove, where it has to grind in there. So this usually we don't have a ton of issues with this joint unless we have like a dislocation or something. And then back to the radial head, where the radial head meets the actual humerus, this is the coronoid this is the capitellum or the capitulum. And the way it meets the radial head, it has to be smooth and fluid, or it causes a lot of issues. This is where it gets complicated with the elbow, because this is the humerus, this is the radial radius, and then this is the ulna. But there's all of these different names that you have to know. You have to know where the trochlea is. You have to know where the coronoid process on the ulna. You have to know where the olecranon is, and you also have to know where the radial head is, because these are where injuries happen, especially like fractures and cartilage issues. So we'll get into that more when we get to pathomechanics, biomechanics, and if you have any questions, reach out.